Healthy Eating and Pre-Diabetes, presented by St. Michael's Hospital Family Health Team Registered Dietitians. What is pre-diabetes? Pre-diabetes refers to blood sugar levels that are higher than normal. Many people with pre-diabetes are at higher risk of developing type 2 diabetes. This would mean a blood sugar reading taken without eating for 12 hours prior of 6.1 to 6.9, or a 3-month blood sugar average called hemoglobin A1C between 6 and 6.4%. What increases my risk of developing type 2 diabetes? There are both risk factors that we cannot control and risk factors that we can control. The risk factors that we cannot control are called non-modifiable risk factors. These include having a family history of diabetes, being older than 45 years old, or having a history of diabetes in pregnancy. The risk factors that we can control are called modifiable risk factors, and these include being physically inactive or sedentary, having a higher body weight or higher body fat percentage, and lastly, having high blood pressure or high cholesterol. Why is it helpful to know if you have pre-diabetes? It is important to know that you have pre-diabetes because some of the long-term complications associated with diabetes may begin during pre-diabetes. Some of these long-term health complications that are associated with type 2 diabetes include a higher risk of developing heart disease, stroke, and kidney disease. The good news is that pre-diabetes is our body's early warning system. It can tell us that we have a chance to make changes to our diet and lifestyle to delay or prevent type 2 diabetes from developing. Why are my blood sugar levels high? In a normal situation, our body's organ called the pancreas releases a hormone called insulin when it senses that there is sugar in the bloodstream. Insulin is like a key which opens up the doorway to our body cells and allows for our bodies to absorb sugar as energy. When we have pre-diabetes or type 2 diabetes, there's some problem with the insulin working 100%, and that means that some of the sugar remains in the bloodstream. Having sugar in the bloodstream means that it travels throughout the body and can affect various organs and cause long-term damage. How to prevent type 2 diabetes? There are both dietary and lifestyle strategies that we can use to prevent type 2 diabetes. These include knowing what types of foods cause a rise in blood sugar, and knowing what types of foods to eat more often to lower our blood sugar, watching how much we eat, choosing foods that are higher in fiber, cooking and preparing foods more often at home, losing weight if we are overweight, manage our stress levels, and including regular daily physical activity. When you have pre-diabetes, it is important to learn about carbohydrate foods, how much to eat, how often, and what type. These decisions can make a big difference to how well you can control your blood sugars and prevent developing type 2 diabetes. What is a carbohydrate? Carbohydrates are found naturally in fruits, grains, vegetables, and milk products. There are different types of carbohydrates called sugars, starches, and fibers. Some of these may cause a blood sugar to rise. They are a source of energy for the body and brain. Types of carbohydrates. There are different types of carbohydrates that affect our blood sugar differently. The first is called refined carbohydrates or sugar. These are found in foods that can raise our blood sugar very quickly. We should try to choose these foods less often. The second carbohydrate is called starch or complex, and these are found in foods that raise our blood sugar slower. we should choose these foods more often. Lastly, fiber. Foods that contain a high source of fiber means that these foods do not raise our blood sugar as high, and we should choose these foods most often. Refined carbohydrates or sugar. These are found in foods and drinks that can raise our blood sugar very quickly, so we should try to choose these foods and drinks less often. Some of these include baked goods like cookies, cakes, and donuts, juices including fruit, vegetable juices, and cocktails, fried foods such as French fries, onion rings, ice cream like ice cream bars or popsicles, white flour, products like bread, tortillas, chapati, or buns, and soda and energy drinks like pop, tonic water, or sugary caffeinated beverages. Complex carbohydrates include starches and fiber. These are found in foods that cause our blood sugar to rise slowly or not at all, and we should therefore try to choose these foods more often. Some of these foods include whole grains such as brown rice, whole wheat pasta, quinoa, and whole grain breads and cereals. Vegetables, any variety including sweet potato, broccoli, carrots, bok choy, eggplant. Beans and pulses or legumes, including chickpeas, lentils, peas, and black beans. And lastly, fruits, wide variety, including apples, oranges, banana, berries. Why is fiber important? Fiber cannot be absorbed by the body and therefore doesn't raise your blood sugar. Fiber helps us to feel more full and satisfied after eating, and this can help us to eat smaller portions. When we eat carbohydrate foods that contain fiber, it slows how quickly your blood sugar rises. And there are many other benefits of fiber, including reducing your risk of developing heart disease, helping you to achieve a healthy body weight, and having regular bowel movements. Where are the carbohydrates? Here are various meals and dishes that we commonly eat, including pizza, dumplings, a curry dish including rice and vegetables, and a deep-fried chicken burger. It's important to know where the carbohydrates are because we've learned that carbohydrates are what can cause a rise in our blood sugar. Why choose foods with whole grains? Well, we've learned that whole grains contain more starch and fiber and therefore help to lower our blood sugars. But there are various reasons to choose whole grains, including they are rich in fiber, vitamins, and minerals. They improve our digestion and overall health. They can help reduce our risk of developing diabetes, heart disease, and certain cancers. And lastly, they are satisfying and help us to feel more full so that we don't have to eat such large portions. Reading nutrition labels on food packages is important to help us understand what nutrients are found in the foods that we choose. When we would like to find foods that are higher in whole grains, we can look on the label. We want to look for the words 100% whole wheat or 100% whole grain early on in the ingredient list, listed either first, second, or third. This tells you that the item is likely higher in whole grains. Now that we've learned of the various carbohydrates that can affect our blood sugar, here are some suggestions and tips to choose healthier options. For example, instead of choosing flavored coffees or specialty coffee and tea drinks, we can choose plain coffee or black coffee and tea and use an artificial sweetener to flavor. Instead of sweet and salty snacks like caramel corn, granola bars, or chocolate or trail mix, we can choose plain popcorn with added garlic or chili powder, a homemade trail mix with added chocolate or candies, a handful or quarter cup of plain nuts or seeds, or choosing cookies that are a little bit more plain, such as arrowroot or graham crackers. Instead of pop or juice, we can choose water with sliced berries or lemon, carbonated waters with a little flavor, artificially sweetened beverages, or low-fat milk. Instead of sweetened or fruit-flavored yogurt, try plain, low-fat yogurt with added fruit, or homemade yogurt smoothie with fruit. Instead of desserts like cookies, cake, donuts, and pudding, split your dessert with someone else and have a smaller portion. Measure out a smaller portion and add some fruit, or make the dessert yourself and use about 25 to 50% less sugar in the recipe. Instead of sweetened instant oatmeals or sweetened cereals, choose oatmeal with fruit, chopped nuts or cinnamon, or add toppings to whole grain cereal with no added sugars, such as fruits, nuts and seeds, nut butters, or cinnamon. What are snacks? Snacks are foods in smaller quantities that we eat in between our meals. Some good snack ideas include a carbohydrate food that you've mixed with a food that contains protein or fat. When we add protein and fat to carbohydrates, it helps to slow how quickly our blood sugar rises. Some examples include a medium apple and 2 tablespoons of peanut butter, 3 slices of cheese and 5 or 7 crackers, or a cup of plain yogurt with a cup of berries. Many foods and drinks have added sugars. We've learned that foods and drinks with added sugars raise our blood sugar very quickly, and therefore we should try to limit or choose these foods and drinks less often. Can you guess how many teaspoons of sugar are in 1 serving of these foods and beverages? In 1 cup of a smoothie with fruit? In 1 container of a fruit punch? In 1 muffin? And in a handful of jelly beans? As you can see, many beverages and foods contain a shockingly high amount of sugar. Even smoothies and muffins, which are often thought of as healthy choices, contain high amounts of added sugar. Sugar is sugar. As you can see, there are a variety of natural and processed sugars. These include white sugars, molasses, nectars, brown sugars, honey, and syrups. All of these added sugars cause a very quick rise in our blood sugar, and it's important to use less of them or add less to our food and beverages. Are artificial sweeteners safe? Yes, artificial sweeteners are safe when used in moderation. Replacing some sugar with artificial sweeteners can help to reduce calories and therefore play a role in helping us to manage our weight. Like all other food additives, artificial sweeteners in Canada go through testing. Once they've been approved, it means that they are safe and suitable to use by Canadians. Eating a balanced meal means that we are including foods from all of the different food groups at one time. This can help to ensure that we're getting all of the nutrients we need for good health, and it helps to keep our blood sugars in control. The way we want to set up our plate means that we have space for all of the food groups. 25% of the plate, we want to include foods that are rich in protein, including meat, poultry, seafood, beans and peas, eggs, processed soy products, and nuts and seeds. 50% of the plate, or half the plate, we want to include a variety of vegetables and fruit of any type. They could be raw or cooked, fresh, frozen or canned, or dried. And the last 25% of the plate, we'd like to include foods that are grains and starchy foods. This can include foods from wheat products, rice, oats, cornmeal, barley, or any other cereal or whole grain product. Mixed foods, or foods that are mixed together, can also be balanced using the plate method by measuring the food groups ahead of time before mixing. Some of these foods could include a curry and rice dish, stir-fried vegetables and meat with noodles, or a variety of soups. We would want to separate the portions of the food groups before mixing. For example, 25% of protein, 25% of grains and starches, and 50% of vegetables and fruits. Eating healthy portion sizes is so important to ensure that we can eat a balanced meal with a variety of foods at each meal. Using our hands is a great way to keep it simple. For fruits, grains, and starchy foods, choose an amount the size of one fistful. For vegetables, choose as much as you can hold in 2 open hands. For meat and alternatives, choose an amount up to the size of the palm of your hand and the thickness of your little finger. And fats and oils, limiting fat to an amount the size of the tip of your thumb. If we include milk and alternatives with our meal, we would say about 1 cup or 250 mils of milk or yogurt would be an adequate portion. Weight loss may help prevent diabetes. Only 5 to 10% weight loss from your current weight is needed to help improve your blood sugars and prevent the onset of type 2 diabetes. Healthy food choices and healthy portion sizes can help you lose weight safely. Safe weight loss goals are around 1 to 2 pounds a week. More than that may mean that you're following a restrictive diet and may be difficult to follow for the long term. Don't forget about the importance of being physically active every day, and consider seeing a dietitian if you need more support. Get moving. Physical activity can help lower blood sugar levels and prevent diabetes. What are physical activity recommendations from Canada? Activity includes any form of movement. When we move, our body burns energy or calories from the foods that we eat. This can help in maintaining a healthy body weight. Start slowly, 5-minute walks a day, and increase it. Increase to 30 minutes 5 times a week as you're comfortable, and try to avoid more than 2 days without activity. And remember, you can do activity in small increments or time frames. For example, 10 minutes 3 times a day instead of all 30 minutes at one time. They all are important and they all matter. Stress and diabetes. Emotional stress can also raise your blood sugar levels. Having a good stress management strategy or some coping strategies are important. Ask yourself, what can you control and what can you not control? Ten tips for stress management. There are a variety of different ways that we can use to maintain calm and try to manage our stress levels. Some examples include reaching out and talking to someone that you trust, going for a walk, meditation, deep breathing, exercising regularly. Give yoga or Tai Chi a try. Put on music that you enjoy. Make time for hobbies, interests, and relaxation. Get enough rest and sleep. Learn to manage your time effectively. And lastly, accepting that there are things that we cannot control. In summary, we've learned that there are a variety of dietary and lifestyle strategies that we can use to help prevent type 2 diabetes. Some of these include, number 1, eating a healthy diet. Some of the important things to remember include choosing foods with more fiber, eating healthy portion sizes and a balanced meal, and reducing foods and drinks with added sugars. Number 2, being more physically active on a daily basis. Work your way up to including 30 minutes of physical activity. And number 3, managing our stress levels. Finding various coping strategies to help us to keep our emotional health well. This video was presented by your St. Michael's Hospital Family Health Team Registered Dietitians. We welcome you to book an appointment with your registered dietitian from your site if you would like further support. You can contact our clinic at 416-864 3022 to schedule an appointment virtually or in person with your registered dietitian. Thanks for listening.